really excited to have this session and to engage in a dialogue here on stage and then with all of you. And I think that this is a really, really important issue that we're talking about more and more in medicine, all branches of medicine, and that is burnout. So I'd like to start the evening with a quote, a small section from a simple pamphlet, which is called Tyranny of the Urgent by Charles Hummel. And I first read this in medical school as part of a Bible study group. And after I read this, I'm going to then introduce our two speakers sitting to my right. And they're going to have some opening remarks for about 10 minutes or so each, after which we'll have some dialogue on stage, and then we'll open it up. So, Tyranny of the Urgent. You can Google it. There's actually some PDFs online. It's only 7 pages long, and it's, I think, one of the most profound little pamphlets that I've ever read. So here's what Charles Hummel says. Have you ever wished for a 30-hour day? Surely this extra time would relieve the tremendous pressure under which we live. Our lives leave a trail of unfinished tasks, unanswered letters, we could update that to emails, unvisited friends, unread books, haunt quiet moments when we stop to evaluate what we have accomplished. We desperately need relief. But would that longer day really solve our problem? Wouldn't we soon be just as frustrated as we are now with our 24-hour allotment? We could hardly escape Parkinson's principle. Work expands to fill all the available time. Nor will the passage of time necessarily help us catch up. Children, when we eventually have them, grow in number and age to require more of our time. Greater experience in profession and church and other activities brings more demanding assignments. We find ourselves working more and enjoying it less. Almost everyone in this audience has experienced these burdens that make our holy profession of healing somehow less noble, less rewarding than it ought to be. Tonight, we're going to discuss and hear from my colleagues how their personal and clinical perspectives have shaped their understanding of our central question for the evening, which is, how do we love our work in healthcare without burning out? So let me introduce them, and then we'll frame the opening with their remarks. Dr. Warren Kinghorn, on my far right here, is a psychiatrist whose work centers on the role of religious communities in caring for persons with mental health conditions and on ways in which Christians engage in practices in modern care. Dr. Kinghorn is jointly appointed with Duke Divinity School and the Department of Psychiatry and Behavioral Sciences at Duke University Medical Center. His current scholarly interests include the moral and theological dimensions of combat-related post-traumatic stress disorder, the application of the virtue theory to the vocational formation of pastors and clinicians, and the contributions of theology and philosophy to contemporary debates about psychiatric diagnosis, technology, and human flourishing. Dr. Tom Hicklin is an assistant professor of clinical psychiatry here at USC, specializing in child, adolescent, and adult psychiatry, so the whole age range. With 5 military deployments, Dr. Hicklin also sees patients who suffer from post-traumatic stress disorder from the military. So let's give them both a round of applause, and Dr. Kinghorn is going to start with the first of the comments.
Thank you all very much for being here tonight. Thanks especially to Josh and Melissa for a lot of work that it took to get us all on stage. This is a big room and we're on this high stage with lights, but I think we all want this to be a conversation, so that's what we invite you into. I have the privilege of going first, and I'm going to start out by talking about a patient with whom I had the privilege to care, and then to give some additional thoughts about how we might think about burnout, especially from the perspective of Christian faith. I'll call him Michael. He was one of the first patients whom I cared for in my psychiatry residency on our inpatient mental health unit. He came to the hospital depressed and suicidal. He tried everything and nothing had worked. He had a strong family history of depression. So we admitted him and started a course of electroconvulsive therapy, or ECT. And after a few weeks, he was feeling a lot better. And I was proud of what we'd done. I thought we'd saved him. We'd given him his life back. So we discharged him with a plan to follow up with outpatient care. I was sitting in my office about 3 days later, and the phone rang, and it was Michael. And I picked up and I greeted him warmly, thinking maybe he had a routine question about his follow-up care. And instead, I heard this slurred and agonized voice. He said, "Dr. Kinghorn, I can't take it anymore. I've hooked up a hose to my exhaust pipe." And I sat up very quickly. And I said, "Where are you?" And he said, "No, you did this to me." And he hung up the phone, and I couldn't call him back. That began a frantic search for Michael that day. One of the nurses on the unit had remembered him saying that he was going to go live with another patient rather than his home address, so we tracked him down. And that evening, I sat with Michael in the emergency department, and he was drunk, and he was angry. He was cursing at me for having called the police to come and get him. And I was exhausted and tired, and I was angry at him. I was angry because he'd ruined my day. I was angry because he'd sabotaged his treatment plan. I was angry because it seemed like 4 weeks of work and a lot of ECT had gone down the drain when he started to use alcohol again. And I left angry and frustrated. The next morning, I woke up and I went into work early. And as I was driving to work, I was still angry and frustrated and feeling a lot of self-pity. And I began to pray. And I prayed, "Have mercy on me. Have mercy on me, God. Let me have a quiet day." And right then, I came as close to I've ever come to having a vision. In that, as I was praying that prayer, that was a very kind of self-interested prayer, I saw Jesus on the cross looking at me in love. And I learned a couple of things that day that I've never forgotten in my practice as a psychiatrist. The first was that it's not just people like Michael that have been broken and have disappointed themselves or others. I have as well, that I stand in need of grace also, and that I'm loved nonetheless, even so. And the second thing is that I realized that I've been putting myself in the wrong place with respect to Michael, in that I've been thinking of myself as kind of the one who'd saved him, that we had saved him, we'd given him his life back. And I recognize that I'm not the savior, and I'm not the one who can take on that kind of responsibility or that kind of burden. I went in and I saw Michael. He was at that point sober and sad. We went outside and we talked on a porch that was kind of caged in. And he told me things he hadn't told me about his childhood. We talked about loss. We talked about trauma. I looked at him and I said that I couldn't cure him, but I would walk alongside him if he'd permit that. And he looked at me and he agreed, and we walked forward together. So what does any of that have to do with the question of physician or clinician burnout? As many of you may know from conversations here, physician burnout and also other health professional burnout is really a major and growing issue. Among physicians, in a couple of national recent surveys in 2011, 2014, first 45 and then 54% of physicians in a national survey endorsed a high degree of burnout, which was defined as either a high degree of emotional exhaustion related to work or a high degree of depersonalization, which means a difficulty connecting with the humanity of our patients. And other clinicians, like nurses, for example, are also at much higher risk of burnout than those in the general population. Physicians and clinicians are at higher risk of burnout than the general population, also at higher risk of suicide, especially actually female physicians related to age and gender matched peers. So this is really a major challenge for us. And as you know, there's been a number of different things that have been put forward to try to manage burnout, to prevent burnout, among things like resident duty hour requirements, wellness programs, meditation and mindfulness programs, Schwartz rounds, medical humanities, writing opportunities. And in a lot of those cases, those have been shown to have marginal but definitely positive effects on treating and preventing burnout. And I want to endorse those. I think those are good things. But I want to talk for a few minutes about how might we think about burnout from the perspective of Christian faith, because I'm a psychiatrist who's also a Christian. And I'd like to offer a couple of thoughts. And first, an observation. One is that we live in a culture that expects a lot of medicine and healthcare. So we don't want to die, and we don't want to suffer, and we look to healthcare to keep us from at least postponing our death and alleviating our suffering. And that's a good thing. But the context of healthcare in the last 100 years or so and the progress has made us think that maybe if we just try hard enough, we can actually do that, that we can maybe postpone or prevent death, or maybe we can alleviate suffering. If we just apply the right technology, the right medication, the right therapy, the right regimen, the right whatever surgery, whatever it is that we're being trained to do. And we have seen ability to sort of stave off death and to prevent suffering. But of course, it's been recognized increasingly that individual physicians especially don't always make the right decisions about the right means to pursue. So we have lots of other things that have come along to help us in our job. Things like the rules of evidence-based medicine and clinical practice guidelines and electronic medical records and lots of other people that are helping to kind of tell us what we need to be doing at any given point. And this applies whether you're a physician or an occupational therapist or a nurse or a dentist. There's lots of examples of how this happens. And yet a funny thing has happened, that right at the point where we ought to be able to celebrate that we're able to apply these technologies rightly to relieve suffering and to postpone death, right at this time, death and suffering continue. And physicians and other clinicians are burning out and leaving full-time practice, and in the process, committing more medical errors and really suffering in our personal lives. There's a lot of physicians and other clinicians who are working really hard at great personal cost to provide the right means to the right ends, and yet people still suffer. And the very systems that were in place to kind of help us do our job, we perceive to be imprisoning us, to actually be limiting our ability to do what we feel called to do. And so you get the depersonalization and the exhaustion and the lack of sense of efficacy that's associated with burnout. So why is this? There's probably a lot of reasons, and that's what I hope we can talk about, the three of us and with you all. But one observation is that medicine as a whole, healthcare as a whole, I think, is, in my experience, better at asking how questions than asking why questions. So we're better at asking, what medication should I prescribe for bipolar depression? Or when should you use an antibiotic for an upper respiratory tract infection? These are how questions. Then why questions, like what is health? Or what is mental health? Or what does it mean to live well? Or what is the role of healthcare within a well-lived life? In my experience, I went through 4 years of medical school at Harvard and 3 years of psychiatry residency at Duke before anybody ever in a formal context ever asked me the question, what is health? I knew a lot about disease, but not so much about what is health. So I'd love to know your experience. And my guess is maybe that those of you that are OT students might have asked this a bit earlier than the MD students, but I'd love to check that out and know that. But a couple of problems come when we ask how questions without asking why questions. We end up kind of with a lot of tools, doing a lot of things, working really hard to put a lot of things into place without actually knowing quite why we're doing it. And then that opens the door for anybody who's authorized to tell us what to do, whether it's the market, whether it's insurance companies, whether it's our institutions, whether it's our professional societies, whether it's patients themselves, to kind of direct us in what to do. But we're not able to quite ask the question, why are we doing this to begin with? I think asking that why or what for question in healthcare is really important. So I want to just offer a few resources, or I might say maybe truths from Christian faith that Christians might affirm that I think might help ask some of those what for questions. And then a couple of practical recommendations, and then we'll engage in conversation with Dr. Hicklin and Dr. Neely and with you all. So a few truths that I think come from the perspective of Christian faith that I think are really important for all of us as we are working in healthcare to avoid burnout. The first truth that I would offer is that we are all, you and we, are fully and deeply loved by God. That God has chosen to love us not because we're star students or because we're star physicians or clinicians or because of our honors or reputation, but simply because we are. And that's enough. The deepest truth about any of us in this room is that we are deeply and fully loved by God. And that's always a place to start. The second affirmation is that we are travelers on a journey. The Christian faith from Scripture and throughout Christian tradition is marked with this image of the human as a wayfarer, as a pilgrim, coming from God as our source and to God as our goal and destination. And in this life, we're on the way. We're always traveling on the way. And that means that we are ourselves wayfarers, and so are our patients, and so are their family members. So the best way to think about healthcare, I think, from a Christian perspective is that the proper role of medicine or healthcare is not to meet a market demand. It's not to create a certain section of the economy. It's not to postpone or even prevent death. It's not even primarily to relieve suffering, although that's, of course, a really significant good. But it's to walk alongside wayfarers, to attend to wayfarers on their way to eternity, and always to ask at any given point, what's needed right now for the journey? If you think of yourself as walking alongside other journeyers, that can go, I think, a long way. A third truth that relates to this is that we are not the Messiah. We're not like individually people who save others as much as we might like to think that we are. At best, what we're invited into in healthcare, this I hope is good news, is not to save others, but to be a small participant in God's ongoing healing and redeeming and saving work in the world, attending to the bodily and maybe mental health needs of people who are on a journey, able to play a small part in helping people to live more deeply and fully. But it's not, that work doesn't start with us, and it doesn't end with us, and it doesn't entirely depend on us. And that's a deeply good news, that it's not all about us. And the fourth truth is that we are bound together in community. So in 1 Corinthians, the New Testament says that, Apostle Paul says that you are all individually, you are the body of Christ and individually members of it. When one rejoices, all rejoice. And when one suffers, all suffer together with it. That we're bound together with each other. So as isolating as healthcare can be at times, that's not the way that we're to live in the light of Christian faith. We're united and bound to each other. So what to do to prevent burnout? So we'll be talking about this for the rest of this forum. The first thing, if you're interested in knowing what you can do to prevent burnout, is to stop doing, just to not focus on doing, and just to be, to focus on being someone who is fully and deeply loved. And a lot can come from that. The second thing, I would say, is to really think about who you're in community with and to always seek sources of community, people who love you for who you are and not for what you can do or what you can produce or what honors you can get. It's really important. The third would be to in some way institute some kind of practice of Sabbath in your life. So people think about Sabbath as taking a day a week for rest, and that may be exactly the kind of Sabbath practice that we're called to. But Sabbath more broadly is in Jewish and Christian life is an act of trust that God works in us and through us even when we are not actively acting. Even in our rest, even at night when we're sleeping, God is at work in us. And so to claim a bit of Sabbath when you're not constantly working and striving is an act of trust that God is continuing God's work apart from us. The fourth thing would be if you're struggling, maybe some of you are feeling burnt out or you have friends and family members who are, then get help. Talk to folks in the Student Health Service here at USC. Seek out the counsel of friends and maybe pastors if you are part of a church or religious community. And the fifth is just know that you're not in this alone. To always remember that we are not those who are to do this alone, and to cultivate not a stance of control, where we're constantly seeking to control ourselves and our patients and seeking always the right means to apply to certain ends, but a stance of wonder. Moving from a stance of control to a stance of wonder, able to see people as the rich and beautiful creatures of God that we all are. There's lots of ways that that could be done. I'd say that if we collectively do that, it goes a long way to appreciating this really incredibly beautiful world that we're able to participate in. Thanks.
Thank you very much. I feel comfort. Thank you very much. I feel comfort from what you said myself, and there's a lot to think about what he just said, so much to think about. I'm going to talk today more about loving, passionate care and ways to avoid burnout, and resiliency, I think, is the main thing. So in doing so, I wore my hiking boots today. I got rid of my work shoes, and I want you all to have some resiliency in your life, because that's so, so important. But I'm also grateful to be here tonight and be in this forum where you don't have to get a lecture and another class and all that
test. No test. Yeah.
All that kind of stuff. And I know he and I both agreed. We don't want any more lectures right now. We just want to be able to think about where we're at and where we're going. And I know you guys have a whole life ahead of you, and you've had a life that you've led in the past. And you know, you think about these topics that we have today, and you know, it's hard for people to believe that they're not in a multiple choice setting where you can say A, B, C, or all the above, because the answers are not that easy. And we've all had the experience of school in a multiple choice setting where you can see the right answer, or you can see two right answers, but this is more effusive than that, and it's a more difficult problem for you for the future. So I think to have a greater scope of ideas is the point here without an agenda, and we're happy not to be constrained. We like academic freedom. We also like freedom to speak to you directly and about ourselves and about some of our patients. I've rarely given a talk to all the medical school class, but I've been with medical students all my career here, teaching medical students one-to-one and seeing medical students in my practice at the USC psychiatry department here on the campus, with occasionally one medical student at a time. And I do understand some of the joys and sorrows that you guys go through. I think we all have to enhance our creativity and have the freedom to learn about ourselves and what we're going to require in life right now, what our needs are, and those things will help you to understand about resiliency and what you can do to keep from being burned out. And I think working and feeling in the present time and with gratitude to where you're at. So many people wanted to be here as a medical student, and you are actually here as a medical student. And I think if you really understand that, you'd have great gratitude about being here and having the opportunity to learn to be a doctor and working with all the patients that we see at the county USC. There's a great number of nice, good patients with classic illnesses. This is a great medical school to be at, and I know that we all feel that way as professors here. I want the medical students to feel gratitude, and I think that's a hugely important part of resiliency. We treat patients for multiple reasons. They come in with acute disorders, with fever, with severe pain. We have a trauma center right across the street that's the most active in Los Angeles. And so you guys have a chance to go to all those areas to meet patients, and you have a compelling job to do. and an important job right away. We also see patients who have papers to fill out and refills where we might want to and not want to give them a refill. And we see all these routine things in our walk-in medical areas, and they're not so compelling. And they take a lot of thought also, and compassion. There's people that come in and they really need your help, and they may not have a fever or a really severe pain, but they have other problems. And in general, then we have some patients coming in for preventative care in the internal medicine clinics, and they have their own problems. And once you really get to realize what their problems are, you find out that they can't read the label on their medicines. They don't know how to take it. They may not get it refilled, and all those things that you learn as a medical student over time. And it's amazing people make it as well as they do. And you didn't realize that they can't read. And many people can speak some English but can't read in English. And so we have a lot of Spanish-speaking patients here and so many other languages that we can't find translators for. We have to go online and get translators, and it makes it tremendously more difficult. So I see healthcare as being able to listen to these people and to work with them, and in a way, it's like negotiating with them in a special sense to find out where they're coming from, what they really want. And most of our patients are not here for an acute problem, but for chronic problems. And it's up to us to be able to connect with them and to be able to understand their needs, even though they may not be expressed needs, to kind of learn to read them. And I think when you see a patient, your brains merge with their brains, and their brains are watching everything. They see exactly what you're doing. They see if you're taking notes during that time, if you're on the computer typing, they see what, if you feel like really, really anxious, they pick that up. And if you're calm, they pick that up. If you're understanding, they pick that up. If you're showing empathy, they pick that up. And it's hard to learn how to express empathy. I'm telling you, it takes time to be able to connect in that way with patients. You have to develop a language for empathy. And some things work for you. You can really get there with an empathic response. And some things are not going to work. And now's your time to try to show the empathy that you feel. Most of you are here for the right reason. It's in your heart. And you feel you have a calling to be a doctor. And that's a huge benefit for resiliency. People that have a strong calling as a doctor, they really want to be a doctor, they have it in their heart, they have less problems with burnout. So it's a huge resiliency is to feel your calling in medicine, make sure you're able to get there. Your calling in medicine is to show compassion to people and have that in the back of your mind at all times. I think another reason that we have difficulty in our healthcare system is that people are in this avoidance mode about death. And it's a topic that they don't want to come to terms with. And I see Phil is here today. He's our hospital chaplain at USC in 2 different hospitals. And he's a great person to call on for chaplaincy service. And we've worked with him for a number of years, actually, here at the medical center. And I'm happy he came tonight. We need more people like him. But you can call on the ancillary staff to get help. And I've often called chaplains services. And even in the night, they sent people, a chaplain who was bilingual in Spanish and could deal with a death, an unexpected death, and a family that was really broken up. So if you get the help that you need, I think you'll have a tremendous relief. I also have gotten a lot of consults from physical therapy, occupational therapy on patients with chronic medical problems, and that was a great relief for the patients. This thing about the fear of death where people have avoided dealing with the possibility that they would die. I mean, you know, we've improved the science of medicine to the point where some people think they're invincible. and that it's not going to happen to them. And, like we've improved seat belts and car safety, and then, somebody goes down the highway at a high speed and it doesn't help, they get killed in a traffic accident. Or we have medications that work, but they don't work for everybody. We have people that have heart attacks, and the doctors, they show me sometimes the results of all their tests, and they're all normal. Their lipid tests are normal, their cholesterol is normal, they work out, and yet they have an acute heart attack, and all of a sudden they're in trouble. They could die. Like statistics and all the science, like with their lipid panel and all that, wouldn't indicate that they're going to have a heart attack, but their coronary arteries do. And sometimes it's the stress of running or something that will bring on some spasm in their coronary arteries, and they have some plaques, and they have a sudden onset of an arrhythmia or something. But the science would say that they're not going to have that. But the fact is that death happens to people, and in a way, what he was saying about not feeling you're invincible is something you have to come to terms with. But the general public needs to come to terms with life and death, and they're avoiding it. They're avoiding the death part. They want a better life. They feel like they can live better with science and seeing their doctors, but they don't bring that up to people, and it's not a topic that they want to talk about, but it's a topic that they should be educated about, and that we should get more public education going about life and death, so that they can come to terms with that, because science can't keep people alive forever. And I think it's a huge importance to healthcare to deal with the concept of death with people. Also, I think in terms of my central belief, I think of life as kind of a matrix of benevolence, because what I'm thinking is that it's going to work out for most people most of the time. And I think happiness comes. There may be certainly joy and sorrow in this world, and believe me, we see a lot of sorrow, but there's also joy. And I think we can see more joy. I think the way the world works is for benevolence. It is a situation that works out for most people most of the time. Now, why would that be? I mean, scientifically, it should work out for half the people, or something like that, or half the time for people. Why does it work out more for people than less? And I think it's because of God or a higher power. And I think if you really look at the fact that it works out, that it kind of proves it. It kind of proves that there's a higher power. And I think we should all take a look at that, because it's the way we're made. It's the substance of our being that things work out. And how does that happen? Like he said, there's maybe somebody looking over us, or that's how we were made. Or even if you don't believe in God, there's some benevolence about life. And you can believe in Buddhism, and that's fine. But there's a way that was, there's a benevolence about that. And I think that's hugely important in being a doctor, and to find out where your patients are coming from in that area. I think we all have a duty to work towards human welfare, and if we believe in this benevolence in life, it takes some of the pressure off of us, because we want to be the best doctors we can. We need to check the serum potassium level. We need to do all the things doctors do before we leave the hospital. But on the other hand, if we have this idea that it's a benevolent world and not a scary, violent world that leads to everybody's death, so I think that we'd be well off to have that for resiliency and for, it's the truth. I believe the truth. It gets you through the tough days and helps you with the joy and sorrow of life. And that's my basic message.
So I'm curious, Gentlemen, and we'll just sort of no order here, whoever wants to speak first. Did you feel issues of burnout cropping up during your training?
We all have, and at times it's intense.
Yeah, what were some of the issues? I mean, what made you or threatened to make you feel burned out?
I think in my case, that both in medical school and also in psychiatry residency, the third year of medical school is just hard. And it's in part hard because you're constantly in a different place, getting used to a new set of institutions with new rules, with new supervisors. So it's like in my context, every 4 weeks your life would just radically change, and all of a sudden you were in a completely different place. And so that created anxiety, but it also created you just never felt settled or at home. And so I saw this happen in my classmates, and I felt it happen in myself. And so to have some community that was continuous, so whether I was on surgery or internal medicine or psychiatry or any other rotation, was really important to have something that was stable and continuous in my life throughout that time. And for me, that was in part a Christian community. It was in part just some kind of routines that I tried to keep stable. And in residency, I think also in the context of psychiatry residency, the first and second year where I trained were very intensive on inpatient services, so consult and inpatient and ER services, and you just see a flood of human suffering. I remember one night working at a state hospital in North Carolina that in a 12-hour period I admitted 17 patients to the hospital. And that was unusual then, and it's unheard of now. But I remember leaving that day and just feeling like, I don't think I can take another story of someone who poured gasoline on themselves and was caught by police, on a bridge before they lit the match. Like, I can't take it. There's too much trauma here, and that was hard. And I just needed people outside of that world to be able to keep me grounded and to remind me that the suffering to which I was witness at any given time was not the ultimate truth about the world, and wasn't the ultimate truth about even those that were suffering, and that helped to get me through.
Yeah, I remember being a pediatric resident, and I'd been up literally all night, had not set a foot into the call room. I was in the ICU on call, and it was into the next day. This was before duty hour restrictions. It was into the next day, and I could barely see straight, and the attending asked me to change a central venous catheter in some child's neck, and I dutifully put in the sterile wire into the old catheter and then was carefully pulling out the old catheter over the wire, and I got the old catheter out and took it out, and then the wire came out too. So I had now just successfully removed entirely the central venous catheter in this very difficult, very unstable child. And that was on the heels of just a string of what I perceived as failures. And to get to medical school or any other professional school, you have to be a successful student. And I was used to being a successful student, and I was used to getting things right. And here I was just getting it wrong all the time. And I remember going home thinking, I can't do this. I'm hopeless at this. I thought I was meant to be here, but God, where are you? What's going on here? And I'm going to ask next about methods that my colleagues and I use to actually avoid burnout. But I think certainly one message is that burnout or feeling that you've made a mistake, that you don't necessarily belong in whatever profession, area of healthcare that you've chosen to get trained in, is a common thing. We all go through that at times, and so I think what both of my colleagues up here have also tried to emphasize is that community is important, and particularly a Christian community is one that can be tremendously vital, I would argue, and being vulnerable enough to reach out to that community with your feelings of frustration and despair even at times. You have anything you want to add to that, or?
Well, I think, when you were raised by your parents, they liked certain parts of you, and, so then they were stretching those parts, and your colleagues and grandparents, they like certain things. You're smart. Maybe you showed a lot of empathy to others, so they love those things about you, and they would stretch them out. The things that they didn't like about you, they'd squash down. And so then you grew up to be here, and now you're doctors, you're on your way. And so I think that you're going to have a reckoning with yourself about who you are and what you want out of life. And like if you felt you were a good singer, maybe you would need to take some singing lessons and develop that part of you that has never been developed. Or if you like karate, I would highly recommend that you try it. And see if you really do like it. One of the medical students is a second-degree black belt in karate, and I was very impressed because I like that, and he's the most stable guy, and he has a lot of confidence in himself. So there's a lot of us that we need to develop because other people influenced us so much, and maybe too much. But here we are, and we're in a good place, in a very good place. You're going to have the opportunity and the money and eventually the time to remember what you would like and to develop those things. A lot of people don't have that. You're going to have it. And I think it's going to be great. It's going to be a great opportunity because you've also succeeded so much in doing what you're doing. You can succeed so much in finding yourself. And I think you can find yourself by trying things on that you didn't have the opportunity and time to do before. And sometimes I tell my patients, it's like trying on shoes to see if they fit, to see if you like them, to go out there and do things and have fun doing them. And you can go with your friends or you can go on your own. You can do things to further address your self-growth and self-actualization, but those are just words. You can find it on your own and find yourself, and I'd highly recommend you do that. People tend to shape you, and is it the right shape for you? And right now it is, but maybe in the future when you're 30 or something, it's not, and you need to find yourself, and that's a challenge. It's a challenge, and I think you need to do that. You may need help doing that, or you may not need help. I mean, and your friends can tell you, and your acquaintances, and your wife or husband, or other people that care about you, that you have a great talent in something, and you can work on that if you want to. And I think that that's going to be a huge issue for you, because you guys are all here for a reason, and I know you're really smart, and you can go beyond that and find yourself.
I would just add and supplement that by reflecting on 3 words that you used in your talk, Dr. Hicklin. So first of all, being 25, which a number of you are around that age, is, I think, a really hard period of adulthood. It's like, because when you're 20, most of you are in an undergraduate context and you're kind of told what you need to be doing and you know who you are. And then, when you get older, many of you will settle into more sort of stable commitments to work and to family and to relationships and other kinds of things. But when you're 25 or thereabouts, give or take a few years, it's hard because all of a sudden you're not told what to do, and everything seems to be up in the air, whether it's relationships and career and everything. And it's hard. It's hard if you don't have a stable community around you to help to kind of navigate those questions. So that freedom that he's talking about can be a burden, because you think like, who am I and what am I supposed to be? 3 terms that he used that I would just say, they're all great terms, and I would just say to those of you who are thinking about healthcare in relationship to faith, they're really interesting terms to think about. So one is gratitude, which we know, this gets to the question of what would you do. We know that gratitude is helpful in reducing burnout and in all kinds of positive mental health outcomes are correlated with people who are grateful in different ways, from decreased anxiety and depression to increased positive well-being. The question is, like, what does gratitude mean exactly? So the word gratitude, comes from the word gratis, which has to do with gift. And so to be grateful is to be grateful to someone or something that is able to confer a gift. And so that makes sense to some extent in kind of a secular healthcare context, because we're grateful to our friends or our patients or others. But what about people who say, I'm just grateful to be alive, or I'm grateful to wake up in the morning? Who's the giver then? And that's where, like in the psychology literature, you often find it's kind of weird. People can't quite define that. Doesn't quite know what it means for there to be a giver in general. And yet, Christians and other people of faith can name that our lives are received as gifts from God. The other is the term calling, which, as he mentioned, so there is some cross-sectional data that related to burnout, that those who can endorse that they experience healthcare as a calling are much less likely to be burnt out. These are correlations, so the causes are a little unclear. There's also some additional data that certain religious clinicians tend to be more likely to say that they experience their work as a calling. But again, if you think of your healthcare as a calling, who is it that calls you? And what kind of calling are you responding to? So that's a good word. And the other word is joy, which is really rare in my experience to be talked about in relationship to healthcare. You just don't see it mentioned very much, but it's a great word. And I would ask you just to think for yourselves, like, how is joy different from pleasure? How is joy different from just being satisfied? And ask your patients this. Ask them, where do you find joy? And my experience is when you do that, when you ask where do you find joy, people will usually stop. And when they finally give an answer, it's going to be something that calls them into something greater and more beautiful than where they find themselves right now. I don't take joy in I enjoyed the chicken sandwich I ate for lunch today, but I didn't take joy in it. But I do take joy in a great conversation I had with the Uber driver who drove me from LAX last night, who's an Armenian cardiologist who's taken step 1 and now training to study here. We had a great conversation, and the beauty of that person was something in whom I could take joy. And I just say, cultivate those practices of joy. And I think that Christian faith in particular gives us a language, a narrative to be able to talk about what that means.
What are tools that you specifically use, maybe 1 or 2 tools that you use to stave off burnout, stave off cynicism, retain that joy?
With an Uber driver, I think you use the tool to stave off burnout and to experience that joy. So, like relating to other people as doctors, that's a huge benefit. So I think it just demonstrated to all of us how you work in doing that, which is greater than 1,000,000 words if you understand, just what he said. I think relating to people is very important. Colin Powell wrote several books on leadership and working as the Secretary of State and also Chief of Staff and with soldiers. And if you read, I've read his books and I've listened to audio tapes. We always drive a lot to get to the hospital and stuff like that. There's audio tapes available, and I was listening to him talk about leadership and how he dealt with it, and he said what worked for him. And what worked for him was driving up to the Pentagon and meeting the people at the gate, which he knew personally because he had taken the time to get to know them, and he knew their names, a little bit about what was happening with them, like their family or whatever they were doing, and they would all greet him. He'd go from there, he'd park, he'd go up to the first gate where he knew all the people that were guards and stuff. He made sure he knew those people. And if you take the time to do that, those people will help you, and they're on your side. And they got your back. Even if you're working in the ER, they're going to really, because you know them, and because you've taken the time to get to know them. That's a hugely important thing to prevent burnout. And I think the support people, and if you really get to know them, take the time, you don't like hold yourself up here, but you hold yourself down here at that level, with working with people and you know and you see every day, and you care about them, and contribute to their kids' cookie drive or whatever. That seems to be something.
Dr. Kinghorn?
Yeah, you can tell we're both psychiatrists, so but yeah, I think I would agree with that. And I would say that for me, there's a lot of things that I think important. I mean, for me, basic things like exercise and eating reasonably well, and I don't do a great job with sleeping, but I know it's when I do sleep well and make a point of good practices of sleep, that really helps a lot. I think stable practices, like in my case, like going to church on Sunday, getting together with a group of other men with whom I meet every couple of weeks for just friendship, being in good communication with my wife about things that are going on, and just really trying to make sure I'm making myself known to others. Those are really important and grounding for me. I think also just in terms of, I would just agree that asking your patients questions that you don't have to ask as part of the EMR can be really helpful. So like ask about tattoos, or ask about ask about something about their history that you don't know already. Ask about sports, whatever it is, but try to connect with them in terms of who they are as people. And for me, it's also been really in psychiatry, where at its worst, psychiatry can be a practice where like you just kind of focus on what are the DSM symptoms, and then you just focus on those, and that's all you need to do because that's what you document. So for me, it's been really important to think more broadly also about like things like race and culture in relation to my patients. And so I work at a VA hospital. A lot of my patients are African American, and some come from pretty rural areas of North Carolina. So for me, knowing the history of race in North Carolina and all of the complexity related to that is really important for me to be able to understand my patients and who they are and who their families are. And same way, like, understanding, like, what's the story of the undocumented immigrant family who's in front of me? It's really, really important. And so I think I would just say it's a great way to just to be alive to the presence of those human beings that are with you, to be attentive to those kinds of things and focus on that.
Yeah, I mean, I couldn't agree more. I remember being given a really good tip. Maybe I'm not a psychiatrist, as I said, but as a psychiatrist, I certainly always imagine that you sit down a lot with your patients. But those of us who aren't psychiatrists, particularly if you're running around in the hospital, you zip into the room, ask a few questions, standing up, and zip out again. Don't do that. Sit down with your patient. It makes such a difference just to sit down for a few minutes with that patient. Even if it's the basic questions you have to check off for your history, sit down for it. But ask one question. I remember a story, I'll never forget it. One of my internal medicine professors as a med student told me the story about, and she was the chief of internal medicine. She was a bigwig. And she would only round on a couple of the patients. The residents would sort of cherry pick which ones to discuss with her, the more interesting, the more complicated. And they said, here's the room of a 96-year-old woman who fell and broke her arm. We can move on. No, that's the one I want to see, said this professor. I'm like, what? Why do you want to see the broken arm of the 96-year-old lady? So goes in, and she's asking all these questions, and she can't really find anything interesting about this woman until she finally says, so, have you ever broken an arm before? And the woman said, well, one time when I jumped out of that boat. And she said, the boat? And she said, yes, the Titanic. So this lady was a Titanic survivor, and nobody had found this out until this professor had sat down and talked to this woman. So sit. And as far as my tools, I can't agree more about a Sabbath. I started doing a very intentional Sabbath during medical school. I did it the traditional way. I did Sundays. It was easy, but it doesn't have to be a Sunday. But I purposely did not do any medical school work on Sundays as long as I wasn't on call, obviously. It was easier during the first and second years. Third year, fourth year got a little harder. But during first and second years, even if I had finals or a midterm or some big exam or something on that Monday, I did not go in and study. I did not touch a book. And you know what? My grades actually improved because I was so less stressed because I knew that I had that whole day to relax. And I made a point of engaging with a Christian community. So that my other tool is engaging with community. both just to share triumphs and to share tribulations. And I think also the talk about calling is important. It's a resource that I think that Christians have, and people of faith have, that others don't have. To remember that you have felt called into this, and therefore if you're called, you've been given the tools. To have that faith that you have the tools that will get you through the hard work. I still do that. I mean, the challenges and the tribulations don't stop when you graduate. They keep going through your whole career. And so if you have that resiliency that you've developed through humility, that was another good tip. Don't treat the nurses and the ancillary staff like they're some kind of an inferior creature. They probably know a whole lot more than you do, particularly when you're a student. But even when you've been doing this for 20 or 25 years or longer, you can always learn something from your patients, you can learn something from the nurses, you can learn something from the janitor. So treat everybody as somebody that you can learn something from. And I think all of those things are tools that I use on a daily basis. And I'm actually going for my black belt in Hapkido. So pursue those outside interests. For me, that's that tyranny of the urgent and the important. You know, if you leave things long enough, everything will become urgent. So time management plays into that. Develop some good time management skills too. But remember, the things that are important, like going to visit a friend, like exercising, like getting a good night's sleep, are not necessarily the most urgent, but they're important. Read that pamphlet. It's a very helpful pamphlet.
I know we need to open it up
Go
for
ahead.
questions.
No, actually, we're gonna.
I would just say that the seeds of burnout in physicians and occupational therapists and dentists and others they don't really start in medical school, or they don't start here. They started when you were in second grade or sixth grade, or whenever it was that you began to feel like you had to achieve at a certain level and present in a certain way and perform in a certain way in order to have a certain kind of worth. And pre-medical training programs absolutely train you in all of the worst ways. Because you're told you have to have a certain MCAT score, and you have to have certain grades, and you have to have certain service activities, and so everything becomes instrumental to achieve a certain end. And so all that happens in medical school is that people just continue to be who they've been formed to be. And then it doesn't stop. That continues in residency. It continues, for those of you that are going to go into academic work, it continues as a junior faculty member. It continues really throughout your life, and it will absolutely continue to suck you dry until you just at some point say, I'm going to get off this bus, and decide to, even if you are in those contexts, to decide to live in a different way with different sets of priorities. But it's not really the fault of medical school. It's the fault of the whole way that we're collectively formed. And I'm that, I'm the first and foremost in that group.
But if you pay attention to these things, you will be successful. Whatever that looks like, you will be successful. So it's 7:05. Let's open it up to your questions, things that you want to ask us, ask each other, discussion. And there's going to be some microphones. If you can use the microphone, that'll be helpful. So don't be shy. Yes, great.
So you guys have talked about how to prevent burnout. My question is, once you're burnt out, what do you guys do about it?
I want to say a few words about that. When you read the studies about burnout, what is the definition of burnout and what that really is very elusive. There's really not a good definition of burnout. But anybody that says, I'm burnout, they're burnout. And some of the studies that have studied burnout didn't have any exclusionary factors. If you said you were burnout, you were burnout. But there are people that have more than just burnout. There are people that also have serious depression. And everything in general is not good in their lives. It's not just medicine. And that's different than burnout. And another thing is there's a lot of people who have been seriously traumatized. And you can get traumatized in medicine. There's vicarious trauma, and there's other ways you can get seriously traumatized. And if you have that, that's not burnout, that's a separate thing. And both of those things need to be treated specifically for what they are. So you have to divide it up and stuff like that in order for you to really know what to do about burnout. There are rating scales for burnout. They're on the public domain. I called the dean's office to ask them about burnout in medical school here. They told me some things. And also, I know the dean cares a lot about you. And if you call the dean's office, you have a problem, he's going to make sure you get help for it. Because as a psychiatrist, we're called in our private practice clinic to take care of some of the medical students that have a very serious problem, and we will take care of them. The other thing is I called the AMA to find out what they had about burnout to help doctors, and I was asking about the AMA library. They don't have a library. They said they put everything online, and they have a burnout scale and stuff, and you can try to see, and they have some suggestions and stuff. But there's, I think, a lot we can do about burnout. But the first thing, being a pediatrician, is preventative medicine, prevent burnout, and how you can go and take a part in the development of the curriculum and other areas, and where you have ample time off to do the things you want to do, and have part of the curriculum about mental health and succeeding in life, and doctors have really made it through hard times, and have that maybe a book club or something that the medical school can provide for you to learn how to overcome things that you might encounter. So I think there's a lot of ways of handling it. First, I say, find out what the cause is. Second, to develop a preventative program. And that's my answer.
I think, too, if a mental health disorder notwithstanding, I think it's really important to reach out to a community outside of medical school or whatever school you're in. And if you're a Christian, reach out to, if you can, a church community, because you'll get perspective from other people who can, and they will also help you provide an outlet. I'm really big on the work-life balance. I really think if you are a slave to medicine and that's all you do, and believe me, it may not seem possible, but you can make it through medical school without being a slave to medicine. Part of it is time management. I would argue that coming home and flopping in front of the TV for 3 hours when you have some spare time is not really, sometimes, okay, fine, but that's not really the most useful or nurturing thing that you can do for yourself. So I would encourage you to reach out to a community if you're feeling burned out, because they will give you perspective. And again, if you're a Christian, they'll pray for you, and it makes a difference.
Yeah, I would just say it's going to be different for everybody, but I think the number one thing is, like, if you're feeling burned out, if you're feeling exhausted, or you're not finding any joy in work, or you're feeling like, then first of all is you haven't failed. Like, and
right.
That's one of the things that students especially are like, this, I can't be burnt out because it means that I'm failing in my work. You haven't failed. This is a really common thing that happens, and you're in institutions nationwide, not specifically at USC, that induce burnout among health practitioners. And so you haven't failed. And so I would say, first of all, if it's to the point where, like, definitely if you're having any thoughts of suicide, if you're having, if you're finding it difficult to function, like to get to work and to do things, then absolutely, see a counselor or a therapist, or get the help that you need. And even if it's not to that level of severity, I think it's more like acknowledging it. So don't just soldier through or kind of press on and pretend that if you just work harder, things are going to resolve, because that often doesn't work, and it just makes things worse. And so it's like more like, I can accept now, I'm feeling burnt out, and that's not good. And so now what am I going to do about it? Like, having accepted this, having accepted the reality of this, what does it mean for me now to take some steps? And those might be small things like exercise, taking time to exercise or to eat intentionally with others or something, or it might be bigger things. But I think the first thing is, like, you haven't failed, you're not a failure, and things can and will be better. And then accept that, and then what are the next steps to take? So.
There's a lot that's written about resiliency, and there's a lot to read about that.
So when you're burnt out, you try to relax, but like in the school setting, there's lots of things to know, and there seems to be never-ending things that you just need to know in order to do well as a student and then a future physician or whichever profession that you will be in. So when you're trying to relax and try to recharge yourself, how do you try not feel guilty about using that time for yourself?
It's a great question. I know for me with that Sabbath, yes, when I first started doing it, I thought, oh my God, that was a whole extra day of studying I could have done. But funny enough, I felt like God rewarded me for that discipline because my focus actually improved. I actually was rejuvenated. I could actually retain facts better in the time that I did give myself. And it also forced me to sort of manage my time a little more carefully. Sometimes, when I knew that I was taking that Sabbath on a Sunday, maybe I had an opportunity to go out to a party or something on a Saturday, and I sort of, maybe I only didn't do it at all, or maybe I only did it half of the time. And gradually some of my friends got to know that I was doing this, and they would tend to schedule fun things on a Sunday if they were going to do it too. And actually other people started doing the Sabbath. Even a couple of non-Christians started doing it. They didn't call it a Sabbath, but they kind of called it their day off. And it sort of spread through part of our med school. It was hard at first. It was really hard because I did feel guilty, but that guilt faded, and like I said, my concentration and my energy actually went up.
Yeah, I'll say, first of all of you are going to be physicians or occupational therapists or dentists or whatever your training program is. All of you are going to be professionals who are doing your work not knowing most of what's in your field that you wish that you knew.
Still don't.
Yeah, so like, I'm a psychiatrist who doesn't know most of what I would like to know as a psychiatrist that's within my field, just because there's so much information. And patients aren't looking for like an encyclopedia, like otherwise they just wheel in up to date to treat a patient. Like they're looking for a human being who's fully present and alive as a human being, who can pull from the right kind of knowledge and skills and wisdom, but also is personally present and centered enough to be able to do the work that we do. And so that, I think, is just, you can just take joy in the fact that you'll never know everything that you feel guilty about not knowing. And there's a difference between like neglecting to have kind of practices of study and feeling guilty about not knowing everything. And I think, all of us are like that. Even those of us who've been out of, training for a while are like that. The Sabbath is not like, there's a difference between like a weekend, which is a term of absence, and a holiday, which is a term of presence. And the Sabbath is the holiday or the holy day. Or even if Sabbath, you think about it in different ways. But Sabbath is ultimately an act of trust that it's not our effort and our activity that keep the world running, but it's God's. And this is a deep truth. And so Sabbath is something that's an ability to step back and to say, even when I'm sleeping, God is acting. Even when I'm resting, God is acting. And it doesn't all depend on me. And there's a kind of joy in that, that the 6 days are for the Sabbath. And so.
I do think it's important, though, for the Sabbath, however long it is, or whenever you do it, or whether it's spread, that if you choose to engage in that there is some intent to it. It's not just I don't feel like working now for 3 hours or whatever, and then those 3 hours go by and you sort of say, oh, that was my Sabbath. No, because that doesn't really have the same level of trust. And there is a trust that you're going to be cared for and rewarded and enriched and nourished out of that. So whether you start with a 2-hour Sabbath or a 3 or a whole day or whatever works for you, make it intentional and try to make it regular.
Yeah, my binge watching of the NCAA tournament until Duke lost was not Sabbath. It was just
right.
Pardon me.
I wanted to address that. I had a medical student that I treated years ago, nobody that you would know, and he had the same problem, and it was pretty bad. And so he was using a lot of sleeping pills, and also he was getting depressed. And because I saw him for a number of sessions, he was starting to get better. And there was another psychiatrist that I wanted him to get to know as a mentor, and because he was kind of interested in psychiatry. So they worked together, and they did some research together. And then I had him see an addictions psychiatrist because of the sleeping pills. And he took a great interest in, and I was seeing him on an ongoing basis too. But the addiction psychiatrist called all the people that were giving him the sleeping pills, and that never happened again. He didn't get any more sleeping pills from those people. He tapered them off. And as time went on, he became, the way it worked at first, they were trying to give him time off. They gave him a month off. And that's the wrong thing to do for him, is to give him a month off. He gets behind, and he gets further worried that he doesn't know what, he can't relax because he's getting further behind. That's the wrong thing to do. So keeping him at work and working with him on these issues was the key to doing this treatment. And it turned out, when it clarified exactly what was wrong, it took us about a year to come to this simple truth. He felt he needed to know everything. He felt he didn't know everything about medicine, and it was hurting him badly. He wanted to know more than anybody could know. He had to come to terms with this field of medicine and not knowing everything. And he finally did. He finally came to terms with that, and he graduated on time. He went to residency at Harvard. He finished his residency. He is in practice, and he's doing great. But he, as a junior medical student, had the same problem. He couldn't rest, he couldn't relax, because he had that idea that he needed to know everything.
There's 2,500 articles on average a day published in Medline. There's no way you can know, anyone can know everything. And if you show up to your school...
That's at least 100 you guys have missed since...
Right, yeah, exactly. We've all missed them. Darn it!
Sorry.
But if you show up engaged and present and refreshed from whatever you've been able to do to keep yourself balanced like that, you will get what you need out of the med school curriculum or the PT curriculum to pass your tests. I'm sure of that.
Right,
Thanks, Ward.
I have a question. Oh,
Yes.
Sorry. So my question is kind of twofold. One being, as a third-year medical student at the tail end of third year, I feel like it's pretty common to feel tired. But how would you, or do you have any way of differentiating or any advice on how I could see a peer and say, oh, they seem burnt out as compared to like normal tired, and any advice on how to approach these peers and talk to them?
So you're right. I was tired at the end of third year, and I think most of your classmates are also tired, especially rotations being what they are. So I think with burnout, one of the keys for burnout, and Dr. Hicklin is right, it's defined in different ways and doesn't always mean the same thing when people use the term. But one of the keys with burnout is there's a subjective difference between being tired but being sort of deeply and joyfully engaged, and being tired and being exhausted and disengaged and checked out. And the latter refers to more of what burnout is. So it's not just being tired, but it's being tired and having these kind of deep questions of like, what am I doing here? Why am I doing this? What is this for? Am I making any difference? That's more what is characterized as burnout. And they go together. Being tired can lead to being burnt out, but I think it's more the other things, like beyond the feeling tired is study is when you collectively are seeing patients and engaging with colleagues. Is there joy in it, or is it just completely joyless and lifeless? And if it's the latter, then that's more what is often meant by burnout. And certainly the place to start is to we'll look ahead, and is there a rotation coming that offers more chance for rest, physical rest as well as spiritual rest? And if so, then use that as a time to rest. And if not, then what does it mean in the midst of a surgery rotation or a really demanding call rotation or night float or whatever it is to find ways to sort of seek out places of rest. And that might look different. It might be engaging in some kind of contemplative practice, contemplative prayer. It might mean cultivating certain times in the week where you're going off and hiking or doing something that's, doing something that's intrinsically joyful itself. It might mean engaging with community, but finding those ways to do those things that bring joy.
Yeah, I think that's, I really agree. I think that underlying sense of joy is kind of the same, like, you can feel tired after a long, hard workout, or you can feel tired after, a long, hard session on a computer filling out some boring application, and there's differences to that. And I think the question is, do you feel like, okay, maybe you're a little sleepy in the morning, but once you sort of get up and get going, do you feel like going back the next day? Or is it, I just don't want to go back. I can't stand this. There's nothing here that's motivating to me. There's nothing that's piquing my curiosity, my interest. That is more symptomatic of burnout because you've lost that sort of sense of joy.
And for any of you, just find someone else and ask them.
Yeah.
So it's not something that any of us have to kind of struggle with ourselves in isolation.
Right.
Seek out someone else and
But
ask them.
it's a grueling process. Third year of medical school is particularly grueling. It's normal to feel tired.
I think he's trying to say there'll be days like that.
Mm-hmm.
Things do get better after the year.
Well, and remember, one of the earliest comments we made is that everybody feels burnout, even not just fatigue and tiredness, but burnout. It happens to all of us for varying degrees of severity and lengths of time. But that's where community, again, I think is so important, both within medical school and outside it.
Okay. Oh, one more question. So again, appreciate you guys talking to us. I was wondering specifically about kind of these times of burnout. For those of you who are religious, during this time, did you feel like, what was maybe God's response, or did you feel like God was trying to teach you something through this period of burnout in your lives, rather than just the response? Like when you look back, you were like, oh, he's trying to teach me about this or that, or something about us, or more profound that's going on deeper inside of us? Or was it purely just managing, what was going on and just trying to trudge through it? And for a non-religious kind of point of view, was there something that you did learn about yourself that you realize, oh, I can't do this, or like, the reason why burnout is happening for me is because I am blank and I shouldn't be blank, or this and that. Looking back, I guess, in your periods of burnout.
Hey, that's a great question. So I'd say for me, both and. It's actually been when I've been in times of my work and life that could be characterized as burnout, that were never enjoyable at the time, but that I look back on as being actually both the most times where I learned the most about myself, and I'm continuing to learn the most about myself, and also the times that were most spiritually formative. And so, remember, in my third year of medical school, I was tired and never quite burnt out in the sort of formal way that we're talking about now, but I was going through a really significant relationship issue, and in the context of all that, I saw a therapist, and that was incredibly helpful to talk with her. I leaned more deeply into community, and I think back on that time as being really important for me to acknowledge that I wasn't fully in control, and that I needed help, and that it was okay to get help. I think at other times when I felt like that, it's the lesson that I've ended up learning, although that I didn't quite see at the time, was that it's okay to struggle, that it's okay to get help, and that I'm loved anyway, and that for me has been, that's what I learned in my third year of med school, and it's what I've learned in my second year of residency, and it's what I continue to learn when I'm busy nowadays, managing a lot of different things in my career, and trying to keep things going. And it's in those moments where I'm feeling like, wow, this is a lot going on. I'm not sure how I can keep all these things going, that somebody will come along and say, you know, it's not about what you're doing. It's not about the papers you're writing or about talks you're giving or about how many programs you have going on, but you're loved by God independently of that, and you can just rest in that. And that for me has been, it's taken those times when I felt out of control to kind of unseat me from that position of control and to say, okay, there's a better life that's there if I can just let go of my need to constantly be in control of things.
For me, this might sound like a joke, but I do tend to focus on the book of Job during those hard times. I'm so thankful that that book is in the Bible. For those of you who aren't familiar with it, it's the story of a man who is walks with God, and for various reasons he goes through a time of just the most hideous trial and tribulation. He's got pustules all over him, and his friends have all sort of abandoned him and encouraged him to abandon God, and he holds fast, and then God brings him through it. And it's the most amazing book. And so I read that more often when I'm feeling really beset and tired and burned out and questioning what on earth is going on. And I have learned, I think, from a spiritual standpoint, the somewhat trite but true, God's timing is not my timing. So I've learned patience through that. And in terms of a sort of a more secular application, I think I also gradually, as I go through each one of those crises, I learn a little bit more, or maybe a lot more about myself, and I become eventually comfortable saying, I'm not good at that, and I'm okay with that, or I'm not good at that, and I want to get better at that, or I'm good at that part, and that's one of my defining characteristics. So I learn more about myself that way, but I also have learned to wait on God and to trust God during those times.
I'm so glad you said that, because the Psalms of Lament, Psalms like Psalm 13, especially, I come back to Psalm 13 often. How long, O Lord, will you forget me forever? How long will you hide your face from me? How long must I wrestle with my thoughts? Every day have sorrow in my heart. Look on me and answer, O Lord my God. Give light to my eyes, or I'll sleep the sleep of death. It's just like this incredibly real prayer. And God never fully shows up in the psalmist's prayer, but it's right there in the Bible, and it can be our prayer too. And the psalmist ends, but I've trust in your unfailing love. My heart will rejoice in your salvation. I'll sing to the Lord, for he has been good to me. So it's a remembrance of God's presence in the past with Israel and with the psalmist, looking to the future. In some way there's going to be a future, and that sustains him in the present. And that, I think I've looked to Psalm 13 a lot in hard places.
Well, the big clock on the back there is telling me it's 7:30. And in an effort to be respectful of everybody's time, we're going to end it at 7:30 now. So I do want to thank all of you for coming. I know there's a couple of final words here from Josh and Melissa, so we'll
Thank
turn
you
it
very
over
much,
to
our
you
panel.
guys.
Let's give them a round of applause.
Thank you, guys.
For more information about the Veritas Forum, including additional recordings and a calendar of upcoming events, please visit our website at veritas.org.